Good morning, everybody, and welcome to my video lectures. Today, I will be dealing with overview of peripheral nerve blocks. Peripheral nerve block involves the injection of local anesthetic medication in the vicinity of a target nerve to inhibit the neural transmission, producing a surgical anesthesia in the distribution of the peripheral nerve and/or post-operative analgesia in the same distribution. Excluded from the definition are neuraxial blocks and intravenous regional anesthesia. Specific nerve block techniques are described detailed in their respective chapters. Basics of the peripheral nerve blocks. Basic peripheral nerve anatomy. The upper extremity is innervated by the branches of the brachial plexus formed from the anterior rami of the C5 to T1 nerve roots. Proximal blocks of the brachial plexus include the interscalene and supraclavicular approaches. Distal blocks of the brachial plexus include the infraclavicular and axillary approaches. The lower extremity is innervated by the branches of the lumbar plexus. The lumbar plexus and branches may be blocked posteriorly or anteriorly. The major branch of the sacral plexus, the sciatic nerve, may be blocked in a number of locations along its course. The local anesthetics and adjuncts used for the peripheral nerve blockade. Many local anesthetics can be used for the peripheral nerve blocks with differing concentrations and volumes in order to achieve the anticipated density, onset, and duration of the block. Individual characteristics are discussed in the local anesthetic. Vasoconstriction, such as epinephrine, prolong the block duration and delay the systemic absorption of the local anesthetic, as well as help identify the intravascular injection. But its addition may increase the risk of neuronal injury. Sodium bicarbonate has been used to hasten the block onset for intermediate acting local anesthetics. Clonidine added to local anesthetics can prolong the block duration for single injection blocks only. Contraindications. Absolute contraindications. Number 1. Active skin infection over the site of the planned needle placement. Number 2 is severe coagulopathy. Number 3, allergy to local anesthetic medication. And number 4, patient refusal. The common local anesthetic used for the peripheral nerve blocks, that is the intermediate acting is the lidocaine, and concentration is 1.5 to 2%. Onset time 10 to 20 minutes, and block duration is 1 to 4 hours. Maximum dose. Maximum dose is 7 milligram per kilogram. Comments and recommendations. This works well for the initial dose when a continuous infusion of long-acting local anesthesia is planned. Long-acting bupivacaine and ropivacaine. Concentrations are 0.25 to 0.5, and onset time in minutes is 10 to 30 minutes in both the cases. Block durations 10 to 14 hours. Maximum dose is 3 milligram per kilogram. And for ropivacaine it is 2.5 milligram per kilogram. Ropivacaine is less potent alternative to bupivacaine, 0.2%, is a popular choice for continuous infusions. And for bupivacaine, this is good choice for post-op analgesia as a single dose or a continuous infusion. Now, coagulopathy. The American Society of Regional Anesthesia has not released specific guidelines on the peripheral nerve blocks in anticoagulated patients. Certain peripheral nerve blocks in the non-compressible areas such as paravertebral and lumbar plexus blocks should be considered high risk for the bleeding complications and are best avoided in the anticoagulant patient. Adverse outcomes have been reported from peripheral nerve blocks performed under general anesthesia, and this practice in adults remains controversial. Okay, now we come to the end of this portion of my lecture, and the next part will be covered in the coming lecture. Thank you.